Hey, I'm Nick Williams, and you are in Medicare Bootcamp. We're going to go over all the details of all the basic benefits of Medicare. We're going to leave out some of the things that are irrelevant, but we're going to cover a lot of what's in this Medicare and You book. We're going to methodically go through these things. We're going to start with how do you get Medicare, or how does a person go about enrolling in Medicare? And then we're going to talk in this video about the initial choices that one may have. You may think you know everything, but a lot of agents don't understand basic fundamentals of Medicare. And if you have a good foundation, then you can build upon that. But what agents often do is they rush through things. They're doing AHIP, and AHIP doesn't train you on how Medicare works. It's just trains you. What people do is they learn how to pass a test. And they go into a lot of things that you'll never ever walk into. We're going to methodically go through this and address it as you, as an agent, would run into these things, either talking to a Medicare beneficiary over the phone, somebody turning 65 soon, face to face, it doesn't matter. We are going to cover the details so that you are better prepared in the future. Again, a strong foundation, and you build upon that. Now, speaking upon building upon that, this program, Medicare Bootcamp, is brought to you by the new 30-day Fast Start program, and you can go to MedicareMillionaire.com and get the details on that. There's a banner there. You just click the banner. It'll take you to a page and tell you all about that program. That will help you get the specifics for you. Again, general information here. The 30-day Fast Start program will get you the specific detailed information and build a plan for you, a personal plan. So let's get started. And most of the time, we're going to start at the how does one go about enrolling in Medicare? Most of the time, they will already have it. And so they will apply for their Social Security benefits, and at the same time, they will sign up for the Medicare. They will be invited to sign up for A and B. Well, they will be enrolled in A and B unless they choose to waive Part B. The only reason they would waive Part B is if they had credible coverage. There are other situations, but let's stay with what will affect the masses, not a few individual cases. We'll go over all those other things, but if an individual still works, they're still at their place of employment, it may be very likely that they have credible coverage. But again, if somebody talks to you, they're turning 65, just don't assume that the coverage they have elsewhere is credible. You want to make sure they speak to their HR department. Again, they're turning 65, they have health insurance at work. You need to make sure it's credible coverage. And in that case, they would not have to enroll in Part B of Medicare. If all the numbers made sense, and oftentimes they will. Oftentimes, group coverage at an employer is better than leaving the group coverage and going to the individual Medicare product. I'm hesitant to change somebody when that happens. And the reason is because they can never go back. That's pretty much the golden rule. They cannot go back to that group plan once they leave it. So again, they will probably stay in that credible coverage, but you need to have them go to their HR department and confirm that that coverage is in fact credible. So let's go to how they actually enroll. We are going to go to the computer here, and we're going to pull up the Medicare and You book. This is very helpful. It's nice to have the PDF, and I want to show you why, because I can scroll down to the table of contents in the Medicare and You book, and I can click signing up for Medicare, and it takes me right to that page where I need to be to get the person the information necessary to sign that individual up for Medicare. So it's good to have the hard copy of the book because we have all the individual state-specific plans in the back of the book. But it's also good to have the PDF because we can do things such as I just showed you. Now, as we scroll further down here, we see a link. And this is in the first paragraph of page 16. If I click that link, That takes me to the Social Security Administration website, which is where an individual signs up for Medicare. You'll find that at the Social Security site, they have a lot of the same information there that they have at Medicare.gov. You can see they talk about Part A and Part B here, supplemental benefits, Medicare Advantage. When I say supplemental benefits, the Medicare Supplement, Part D drug cards, they go into all that. I want you to pay attention to this. And this is important. This is your turning 65 enrollment period, your SEP, if you want to call it that. If you're eligible at age 65, your initial enrollment period begins 3 months before your 65th birthday, includes the month of your birthday, and ends 3 months after your birthday. So your initial enrollment period, turning 65, is a 7-month period. 3 months before you're 65, the month that you turn 65, and the 3 months after. So pretty simple, right? Okay, let's move down the page here. And here's where we help the individual apply for Medicare. Or you can just direct them to the site. And you click that button, and it takes you to a terms of service for utilizing the application. And you click that, hit next, and we are at the beginning of the Medicare application to sign up for Medicare. So start a new application, and thus we are beginning our questions. And it starts off, am I applying for myself? Am I helping someone who is not with me and therefore cannot sign the application at this time? I'm going to get off this page now, but I do want you to see how a person signs up, because I have agents, they're licensed agents, and they say to me, Nick, somebody's signing up. Somebody needs help signing up for Medicare. How do they sign up? Chapter 1, page 15. It's right there. You shouldn't have to ask me. You shouldn't have to ask anybody. It's right there. Again, you go to this clickable PDF. What I'll do is you send me an email, Nick at Medicare Millionaire. I may put it in the notes section of the video, but you send me an email and I'll send you the links and everything that I use to give you the information here in this video. Now, we submit that application, and in a reasonable amount of time, they will have their Medicare card. It comes relatively quick. You don't have it usually within 30 days, they'll have that Medicare card. Now there's a decision to be made. And I'll tell you something, you better make sure if you're going to do that work, get them signed up for Medicare, that you already have a preset appointment for a certain time period, at a certain period, so they know, hey, you're coming back. So already have another appointment scheduled. Make sure, because I tell you something, they will dump you. The Medicare beneficiary, if you're not there and you if you haven't tied down that relationship properly, they will go ahead and sign up with another agent because they're getting called every day. As a matter of fact, you help them sign up for Medicare, they may forget your name. Remember, these are old people. You need to lock that down. You need to set another appointment. You need to stand out from the crowd at that moment in time. You cannot just say, okay, I'll call you back next month. Or give me a call when you get your Medicare card. You need to be on it. You really need to be on it. Because these people, they want to be, how shall I say it, a good client, but sometimes they don't exactly know how, because again, they may fail to remember. They may get confused. They may just get overwhelmed. They may have a bully agent that comes in and just pushes them. They may have somebody that's not honest with them that says, yeah, we're the ones that helped you get that card. That was somebody at my company or something. Don't put it above another agent that is going to say that. And I hate to say that, but things happen, and everybody that's been in this business a while knows that these things happen. Now, so we have established that our client now has Medicare. Whether they got it because they signed up and they received Social Security benefits, or that we helped them sign up for their Medicare-only benefits. We've also established that in all, unless they have credible coverage, and there are a few other exceptions, that they need to take that Medicare Part B. There is a penalty factor there as well if they don't take that Part B, and that penalty is significant. and it never goes away. The Part B penalty, if they fail to sign up in a timely manner, if they receive that penalty, it never ever goes away. So that's no fun. And I've been down that road with people, and they've gotten bad advice. So just make sure they have credible coverage. So here we are. We have a client. They want to do business with us, and we have to help them make a decision. Well, first of all, they can't do nothing. But that is an option, and people choose that option. Sometimes people get stubborn, and they'll choose that option. But it's foolish. Don't let them choose that option that they do nothing, because then they got that 20% out of pocket on the Medicare Part B, where there's no cap. There's no maximum out of pocket. And they also have the hospital deductible in Part A, and they have significant daily room cost if they do not, how should I say this? They have that room cost, that in-hospital cost, if they have a lengthy stay. They have a bunch of days, but those days can run out, and it will get real ugly if that happens to them. So now again, what are they going to do? Well, they have options. Here we go, right here. We have, and I think you can see that. I hope you can. It is on page 70. Actually, it's not on page 70. We're on page 6. I'm sitting here looking at it. It's page 6. We're not at page 70 yet. That's over here, page 70, page 6. And you have a choice. You can go with original Medicare, and you get Medicare Part A, Part B, you purchase a drug card, and you purchase a Medicare supplement. You get A and B, okay? We've discussed that. Purchase a drug card, purchase a Medicare supplement. That can be anywhere from low, $100 and some, depending on the state you're in, male, female. And these are guaranteed issue, by the way. The Medicare supplements are guaranteed issue. No medical questions. No medical questions at all. And that's going to cost a premium, and that premium is going to go up every year. And they're going to get an age rate increase. They're going to get a cost of their cost of insurance increase, basically a medical inflation increase as experienced by that particular company. Some companies have pooled rates, and so there's different types of rate structures, but basically that's how it works. So they can do that, and if they do that, again, they'll have a Medicare supplement. You use a quoting system such as CSG Actuarial, which is going to give you the prices of the Medicare supplements in their area. You basically put in their zip code, and you put in their age, and then the CSG Actuarial. And again, Nick at MedicareMillionaire.com. If you need information on CSG Actuarial, we'll get that to you. Then you basically just give them the lowest price product, because actually, let's not get ahead of ourselves, because there's another option, but we'll get into that because later. The other option is that Medicare Advantage plan, okay? And that Medicare Advantage plan, just as it says on page 6, Medicare Advantage is an all-in-one alternative to original Medicare. These bundle plans include Part A, Part B, and usually Part D. So it's a MAPD, Medicare Advantage with Part D, or it's a MA only. The vast majority of MA plans written are MAPD. So that's why you say, that's why it says, and usually Part D. So normally a Medicare Advantage is all the coverage rolled up into one plan. Now what's nice about it is it's often very low premium. But more often than not, there's no monthly premium at all. So that's attractive. So now we're looking at a Medicare supplement, which again, depending on the state, could be anywhere from $100 and some, low $100 and some, to an expensive state where it's much, much more. And if somebody has medicines, they have to get a prescription drug card that may cost $80, $90 a month. It's a whole different ball game. They could be at a couple $100 just like that. So that's a problem. This Medicare Advantage plan, zero premium. Almost every state has a whole bunch of zero premium plans to choose from. Now, that doesn't mean that this is the best option. It just means that for somebody that doesn't have much resources, disposable income, fixed income seniors often do not have disposable income, this becomes a viable option for them. And even people that have money will choose this. And I've been down that road and they demand it sometimes. So they will also, with the Medicare Advantage plan, they will rebate Part B premium. So that premium that is taking out of the Medicare beneficiary's Social Security check to pay for Part B of Medicare, they will refund them a portion of that. So it may be, let's say, I know in 2021, there's a company that's going to rebate $70 per month. So that's $70 rebated. I believe that's $840 a year. I'm probably wrong there. I don't have a calculator. Oh, where's my phone? Where's my calculator? I don't know. But I believe that's $840 a month. That's a rebate. That's money that's given, not given to them. It appears as though it's given to them. You can't say it's given to. You can't say we're going to give you more money. That would be unethical. But what's going to happen is you tell them the net effect is that your Social Security check is going to reflect that money not taken out to pay for Part B premium. So therefore, you'll have a greater deposit into your checking account if your Social Security check is direct deposited. So you're going to get $70 more because you enrolled in this plan than had you not enrolled in this plan. And that's $840 a year. That's a lot of money for a lot of people, especially if you look at the swing where they would have been paying, say, $125 or $150 a month as an alternative. So it's a big swing in the other direction. Now, what's the problem with these plans? Let me go to the board here and tell you. A lot of you know that Medicare Advantage plans have co-insurance. Co-insurance, I hope that you can see that. They have copayments. And they have deductibles. And that's, okay, now some of the Medicare supplement plans will have copayments, okay? And, but this is a whole different ball game. This is significantly different because it's a little bit, it's not clear, and it's it's in all the different benefit categories. There's going to be co-payments for ambulance, hospital, daily hospital stay co-payments. There's going to be emergency room. There's going to be doctor visits or specialists or chemotherapy or testing. It's going to be all these little payments. So it becomes confusing. And the client doesn't know exactly what's going on. They want simplicity. And that's one of the big problems. But there's another problem. What is it? What's the other problem with Medicare Advantage? You got it. Networks. And I am running out of ink there. Let's see if this is any better. They have networks. Now you have HMO. And you have PPO. Oh, that's not P. PPO. So, and that was not working well either. Bob was ready for you there. And I have backup. So HMO, PPO, but it's not black, it's brown. The HMO is a problem because you may need a referral to see a specialist. So the HMO, you have a network, and then if you want to see a specialist, you need a referral from your primary care doctor. That's not the case with the PPO. PPO, generally, you're not going to need a referral. Now, there are some HMO POS plans that don't require a referral. So I just want you to understand that there's exceptions to every rule. Now, the PPO, I don't want you to disregard the PPO as a viable option because these things are national. There are national PPOs and they have incredible networks, incredible networks. So your prospect or your client may have hundreds of thousands of doctors nationwide to choose from. They have incredible networks. They blanket the entire country. So the PPO and even the HMO in some cases, if they don't leave the neighborhood and they're happy with everybody in the network, well, it's not really a big deal, other than that referral issue. So that's the HMO. That's when they're stuck in the neighborhood, and that's the only place they're going. And some people are stuck in the neighborhood, and it may have a little bit better benefits, but it may not. The PPO may give you the ability to see any doctor in the network anywhere, and it may even have better benefits. So you never can tell. It's not like you got to give up anything for the PPO. Now, there's one other problem with these Medicare Advantage plans. And what is that? I can't hear you. It's that they change. They change on an annual basis. Every year, your plan will change. That's the way it is. Every year, you're going to have a change in your plan. So you need to be aware of your clients, because if there's an area where there's a major change in a plan, and your clients, they send out a statement. It's the annual notice of changes. So it's the annual notice of change document. It goes out every year prior to the annual enrollment period. And it goes out every year prior to the annual enrollment period. And it notifies your Medicare beneficiary, your client, the Medicare Advantage customer. It will notify them of the changes. But you know what? They won't understand it. It will be just more stuff. And they get bombarded with stuff, so, especially during the AEP. So how in the world are they going to know, especially if there's any medical terminology being used here that would be in any way sophisticated, when maybe your clients have no sophistication in medical terminology? That is a problem, that there is a problem forthcoming in the next calendar year. So you got to be on that. And because your clients now, there is that opportunity to make another change in the first quarter of the upcoming year. So that opportunity does exist. There is an out for them. But these are the problems. These are the problems with the Medicare Advantage plan. It's the co-insurance, the co-payments, the deductibles, the networks, it's the referral requirements, and it's the fact that the plans change. Even having said all that, a lot of Medicare beneficiaries are choosing Medicare Advantage plans. They're good plans. They've come a long way, and they give your clients all kinds of extra benefits. They give them dental. Now, your Medicare Supplement isn't giving all that stuff, like the dental, the over-the-counter benefits. There's a plan that has a grocery card. They have where they can go in the grocery store and buy groceries. They have the gym memberships. They have optical. They have hearing, vision. They have a plethora, transportation, all kinds of benefits that you do not see in Medicare supplements. So there's substance to the Medicare Advantage. I don't think you should be exclusively a Medicare Supplement agent or a Medicare Advantage agent any longer, because if you try to pigeonhole everybody into one category, what's going to happen is those people you're going to lose clients, because they're going to say, wait a minute, when they find out their neighbor's got this other plan, whether that be a Med Sup or a Medicare Advantage, who's in the same economic category as them, and that plan is more appropriate for them, but you're a Sup salesman, so you just sold them what you sell, or you're a Medicare Advantage salesman, so you sold them what you sell, and really it may have been more appropriate they buy another product. Now, let's talk a little bit more about. I'm getting winded. Let's talk a little bit about the Medicare Supplement. I did mention that you can go to the CSG Actuarial. By the way, this right here on page 7 of the Medicare and You book begins a actual line-by-line comparison between the Medicare Supplement and the Medicare Advantage plan. It continues over to page 8. So you might want to take a look at this in your Medicare and You book to, if you want to get more detailed information on this. Because there are other things that you need to be aware of. Now, for the Medicare Supplement, you go to, again, it's page 70, but on the previous page to page 70, and I will go right here. As a matter of fact, I'm going to bring it up here. If I can bring it up, I'm going to do so, and I can. All right. I'm going to go to page 70. Actually, I'm going to go to page 69. And on page 69, I'm going to come down here and highlight in the second to the bottom paragraph, and you can see it here if you look at it. All policies, referring to Medigap policies, Medicare supplements, all policies offer the same basic benefits, but some offer additional benefits so you can choose which one meets your needs. Okay, those additional benefits are usually like an optical discount card or some card they can use to get discounts or something like that. They're usually not significant. AARP has their plan with United Healthcare, but they have to buy the AARP membership. So that's different. They have to pay for something. They can buy any membership, so that's not part of this equation. The point is, and if you look here, and we'll just go to page 70 here, this grid tells you what needs to be done regarding Medicare supplements from your client's perspective of which plan works for them. Now, 9 times out of 10, I'm going to tell my client to go with Plan G. Now, what do we know? Let's back up a little bit. Because I skipped something, and maybe I shouldn't have. It says every Medigap policy, I'm starting right here, I'm starting in that same paragraph, but I'm just reading the part that I skipped before. Every Medigap policy must follow federal and state laws designed to protect you and must be clearly identified as Medicare Supplement Insurance. Medicare Supplement Insurance. Insurance companies can only sell you a standardized plan. We've discussed that. Standardized policy identified in most states by letters A through D, F, G, and K through N. Now we'll go to page 70. These are those letters. These are the plans. In essence, it comes down to price. And if all the plans are the same, well, the lowest rate is the plan that your client should take, right? Well, maybe, and probably. But there are some other factors. Some companies are notorious for rate increases. Now, we do have ways to, we can help agents determine, because there are tools available to help you determine past rate increase history with different companies. So we can talk about that. Again, Nick at MedicareMillionaire.com. We can, oh, by the way, we're not just answering a bunch of questions. We get in depth in answering questions with people who want to work with us. So there's a million questions. We can't answer a million of your questions, but if you want to work with us, we can. So there's a plug for us. But let's get back to the information. The CSG actuarial is going to give you the lowest rate. It may be that the lowest rate company is a company that's notorious for drawing people in with low rates and then jacking their rates up. That happens. But it's hard to, if you have a client that's price conscious, it's hard for you to say, well, and it's not hard for you to say, but they may not want to hear anything but just give me the lowest rate. Now, sometimes you'll find it's a couple pennies between, or $1.50 or something like that, between the lowest and the second lowest. And it may be a company that you've had bad experience with in rate increases versus a company you've had good experiences with, or that are just have a better, one has a better history than the other. But you know, the past doesn't always dictate the future. So you could even be missing the boat there, because I know people that are with companies, and I'm not here to bash companies, so I'm not going to name company names, but it may in fact be that the company that had high rate increases, their book has stabilized and they're not jacking them through the roof. And versus another company who's had a good rate increase history, meaning very low. And there are companies out there that they've kept them below 10% for the longest time. And now all of a sudden they jack you through the roof. There's another one where companies will play shell games. Each company may own other companies. So you have a parent company owning multiple subsidiaries or brother or sister companies, whatever you want to call it. It doesn't matter what it's called, but it's a shell game. They'll build one book of business up, and then they'll start another company or buy another company. Whatever they do, they'll begin selling a new line of Medicare supplements. It may be the same company with a different line, but typically it's another corporate entity and with another line of product, and that line of product is going to be the low ball rate, and the other one will get jacked up exceptionally high. So there's little games that they play, but for the most part, these companies have to stay in line. They have to, when I say stay in line, they're adhering to, and they answer to Medicare, and so they can't be predatory, and you don't see Medicare supplement companies being predatory, but because they can just be, Medicare could shut them down if they so desired, and you don't see it happening because that just isn't something that happens in this industry. But there's also the fact that somebody may have name recognition could come into play. And if the person just wants Blue Cross and Blue Shield and that's all they want and that's it, they demand it, well, maybe that's what you sell them. It doesn't mean you have to sell them that, but maybe that's what you sell them. But you might say, well, sir, this Blue Cross and Blue Shield, and again, this is not speaking, this is just hypothetically, again, because Blue Cross and Blue Shield is different in different states, so it's certainly not accurate. But it might be that you'd say, well, your premium's 20% higher than, Blue Cross is 20% higher than Company B. So I'll put you there if you want. I'll make more money if I put you there, but it's foolish, or is it that a company that they had their health benefits with at their previous employer, so they had Cigna, and they're like, can I keep Cigna? Well, yes, you can. Well, I like Cigna. They took care of me. And you have to tell them this is Cigna Health Spring. It's not exactly the same company. It's a different corporate entity, but it's carries the Cigna brand. And Aetna has those types of things. Lots of companies have that type of setup where they've provided benefits, group benefits, pre-65 health plans, and now they're providing Medicare supplements. So let's see. I think we've covered a fair amount of information for this section. I do want to say again, I'm going to say this one more time. This is general information. We're going to cover a lot in this series. We're not going to have another video out for like 3 days because that's the plan. And then they're going to come out much faster after that. But we want to get people, we want to get as many people to view this first video as possible. And then we're going to get the other videos in the series out. Now, we want you to go to MedicareMillionaire.com. We want you to go look at the 30-day agent Fast Start program, and we want you to sign up for that. You need to have a plan, a strategy, a daily work schedule. That's what the Fast Start program does. So get on over there to MedicareMillionaire.com and welcome to Medicare Bootcamp. Video number 2 is going to come out again in 3-4 days, and we will see you then. Bye.